everybody. We are back on the Recharging the Human Battery radio show. I'm your host, Dr. Stefano Sinicropi, and we are on AM 950 radio today. Interesting show here that we really need to talk about. So this past weekend, and this is going to air, a little bit later, but when in the time that we're recording, President Joe Biden made the decision essentially to retire from the 2024 race, and it obviously completely changes what the 2024 election looks like. But that's for those of you that know me, that I don't really get into politics and the back and forth. My concern as a physician is looking at ideas and values that either party or the other smaller parties have when it comes to promoting health and wellness and getting our healthcare system going in the right direction. And it's very, very complex. So this is the lens I'm always looking at it. And we just need to talk about issues that are relevant for today's time. But what this announcement by Joe Biden made me think of this weekend is the very important topic and question that I actually get asked a lot. And honestly, amongst physicians, we talk about it quite a bit. And that is, when is the right time for us as physicians to start considering the retirement question? I mean, you want to talk about a really complex issue that we've got to be, frankly, really careful because, on the one hand, we can be offensive when saying that. And certainly we have to be cognizant of how incredibly important our older physicians are into passing needed knowledge and wisdom to us. Without them, we really would be nowhere. And they've really paved the way for the way we practice today. And we have so much to owe them. And I have so many colleagues that are well over 70 years old. Some are in the 80 range who are incredible physicians. And I hope they stick around for a long time because they have all their faculties. They love teaching students. They have such a heartfelt passion for what they do. On the other hand, we have to be cognizant of both mental and physical difficulties that we get into as we age. And I've seen many physicians who are struggling on a daily basis with just pain, and they might be even younger. And that brings up this question, but certainly cognitive performance can decline as we age. And the truth is, it's going to decline over time, and it declines at a different speed in all of us. Not everyone's the same, right? There are 75-year-olds that are way sharper than I am and could run circles around me in a conversation, but there's others that clearly have experienced significant cognitive decline. If we don't have open and honest conversations about these type of topics, we really cannot come together and help people to make these very personal and complex decisions. Now, this topic goes way beyond that. One is, what's the physician's legacy? One is, can they still do teaching without maybe performing surgery? Another one is, how are organizational bodies, hospitals and others looking at aging? And, is there a time? Are there tests? Are there cognitive tests? Are there certain age cutoffs that we need to utilize to help physicians make that decision? Because we have to make sure that everyone is performing at least on par so that we can give safe care to the patients. And so as we go to the break here, I encourage all of you to start thinking about kind of what the ramifications are of what I just spoke about. And let's get into a deep dive and discussion on the other side of the break as to when we should think about retiring. Okay, everybody, and welcome back to our radio program today. We are on AM 950 radio, and this is Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. Thanks for joining us today on this important topic of when physicians should retire. So just a little recap, the president decided to step down and retire from the campaign, and there were just so many issues around his ability to be able to lead for the next 4 years. A lot of that was actually a bipartisan issue. There was a lot of questions on both sides. And to be perfectly frank with you, this happens no differently in all professions, but certainly it definitely happens with us as physicians. And I've seen it on a firsthand basis. And honestly, it goes both ways. And so just briefly, I have had mentors that were around, 80 years old who have been incredible. They were still doing surgery. They were doing it very, very well. And the lessons that I learned from them, I could not have learned from people that do not have the advice and the experience and the wisdom that these wonderful doctors had. And also, you know what? Give credit where credit is due. Most physicians don't need to practice until they're 80 years old. Most of them do it because they love what they're doing. And the fact that they love it and they're dedicated and they want to see the younger generation succeed and do better and want to pass on all of their information to us is amazing. Could you imagine if everybody decided to retire once they, passed a certain amount of years in practice? Where would all that knowledge go? It would be gone, right? Unless they were very active on social media or they were writing books or doing other things. But if everybody retired and bought a cabin here in Minnesota and went up north or decided to move to Arizona or Florida or Europe or wherever, we're going to lose so much of that incredible and invaluable wisdom and information. And I cannot overstate how important it is. And those of you that are listening, I'm sure that many of you have older physicians and you love them and they do an amazing job and they care and they do great by you. They still stay up on all the latest and greatest that's going on in the medical world and cannot be overstated. On the other hand, I have personally seen older physicians and even kind of middle-aged physicians struggling with either mental cognitive decline or physical decline to the point where it's clearly affecting their performance. And unfortunately, it turns into a lot of, doctor speak in the lounges and questioning and things being said by administrators, nursing staff, and others. And it is a painful, painful thing to watch. No different than what we've seen in our country go on at the highest level. I mean, this happens every single day. But I've also seen it where it's more in between, where just because a physician is older, everything they do is magnified by a factor of 10, and it's almost like people are looking for them to make mistakes or misspeak or have potentially some type of a complication. And it's no different than happens to anybody. It can happen to physicians that are in their 30s. However, when it happens to somebody who's older, where questions have already been brought up, it becomes very, very difficult. And once those things begin, it's very difficult for them to defend themselves and turn things around. And I've seen some very difficult situations, some of them warranted and some of them not. And it can become heartbreaking, and it affects their own personal self-esteem and how they go out. And there's nothing more difficult than being literally forced to retire. And it absolutely happens in the ranks of physicians. So I really wanted to talk about it today because it's something that's not talked about enough. It's almost a taboo subject, and it shouldn't be. You know what? Aging is a normal part of life. Now, you guys that know me that I'm always talking about longevity and wellness and well-being. I am a massive proponent of doing all kinds of things with our lifestyles and well-being and biohacking to preserve our mental and physical abilities well into our old age, and really learning how to live the best lives, as we age. However, Father Time sometimes will catch up no matter what you're doing. And depending on your genetic predisposition, your lifestyle choices that you've made, and a whole host of other issues such as stress, and other things, sometimes it just catches up. And we need to have a frank and open and honest discussion, because we want to address these issues before they become problematic, before it becomes an issue of self-esteem or being defensive or other things. And we want to be very, very careful and cautious in not labeling people as old and frail when they are, sharp as a tack mentally and able to do incredible things still, both as physicians in the office and as physicians in the operating room. And again, it's not a one-size-fits-all issue, but if we don't discuss it, we're never going to get anywhere. So let's start with some facts. As far as the, physician workplace, more than 40% of actively practicing physicians in the United States will be 65 years or older in the next decade. This is a big demographic shift, and it is something that we need to talk about. Now, it presents both opportunities and challenges for the medical community. As the baby boomers are really continuing to age, so many of them have dedicated their lives to being physicians, and they need to make these very difficult choices. And then, my generation, I'm a Generation X, will be needing to be thinking about how to make, I don't know how to call it, I guess a graceful exit when the time is right. When the time is right, not only for us as physicians, but when it's very clear that we might not be in a position to be doing the best things for patients in the system. So on the one hand, this plethora of older physicians brings a massive wealth and expertise to the community of medicine, and it is so incredibly needed. And we need to find better ways to really take all their great information and put it down, just write it down like we've been doing since we were able to write, from the beginning of time. We wrote things down. We wanted to preserve the knowledge. And listen, we're thinking about things that happen in Egypt and all these other great civilizations today. We're able to do that because they wrote it down. So not only do we have to focus on the science part of it, but we have to really put their wisdom somehow down on paper so we can all learn from it. And that's one thing, to take away from this. These physicians have spent decades honing their skills and accumulating knowledge, and all of this is a top priority when delivering healthcare. And I can tell you right now, I'm currently working with many physicians that are in their 60s and 70s who deliver outstanding care. I have colleagues who are in their 80s who are doing incredible things, and some of them have actually retired from medical practice, but they are still tremendously involved in writing papers, writing books, teaching younger, physicians, spreading the knowledge and information around. And so, listen, we got to just be, we just have to, we need their wisdom to be passed on, and we need their wisdom to really be heard and listened to, because as, younger, physicians, we don't really have all the answers, even though we might think we do, and we need to open our ears and listen to what the older generation is telling us. Same thing for those that are in the generations below me. I hope that they can listen to the wisdom that I try to impart with them, now being a physician kind of in the middle of their career. And so I think we just have to have an understanding of how to harness the power of wisdom. Cannot be overstated again. On the other hand, we absolutely need to acknowledge the potential risks with an aging workforce, and understanding there's going to be some cognitive decline, and there's going to be a lot of physical struggles. And ultimately, right, not just as physicians working with our colleagues, but ultimately, working with hospital associations and working within credentialing bodies, we have to be very honest and, think about patient safety issues that can develop if cognitive and physical limitations, okay, things like pain, spinal stenosis, other things that we might be going through as we're human as anybody else, if that starts affecting actual patient care, then it becomes something that, although it can be uncomfortable, although it can lead to some very awkward conversations that nobody wants to have, they could not be more important things to have, because we never want it to end badly. And sometimes it ends up ending badly in any situation. And whether that is with, compromised patient outcomes, or with physicians being forced out of the workforce and feeling so bitter and feeling so disrespected and so angry because that happened, that is what I would consider a bad outcome. And, we definitely don't want that to happen. So let's talk about the retirement decision. Really, what is going into it, okay? I'm not talking about people that have, kind of founded other companies where they leave the workforce, or are just plain old, burnt out and leave the workforce early. I've talked about that a lot. That's the subject of an entire other episode. We're actually going to have a lot of guests on just talking about burnout and resiliency in general in the workplace, and that obviously applies to physicians, which are near and dear to my heart, and I talk about it all the time. But there are so many other factors that lead physicians to end up retiring. So let's just go through kind of what I would call the big five. What are the big five as we get older that physicians tend to start thinking, geez, maybe this is a good time to think about retiring? What's going on? And then they start having these loops in their head, and eventually they make the decision, and hopefully they make the decision in a timely fashion and in a way that works for them and their family, so they can successfully really transition to whatever they feel like they're doing. And a big plug, I hope that physicians, as they retire, at least dedicate part of their time to continuing teaching. Again, whether that be through media, through writing books, through part-time, through becoming professors where they're lecturing, whatever you can do to continue passing on the information is wonderful. So let's go through the big five. Number one is physical health. Okay, I've seen so many physicians that I work with personally who are absolutely struggling. Every day they come in pain, whether it's hip pain or back pain or pain for some injury that they've had, or total body pain, or they're dealing with some type of autoimmune disease and they're riddled with pain, or they're dealing with cancer and they have cancer pain and are still trying to push through it. Listen, this can affect physical stamina and dexterity, and there has to be ways to openly and honestly discuss if you can still safely perform the procedures and can get through it without being in excruciating pain. And sometimes it's almost not even fair for them to have to do it. And there's other factors that may be why they're hanging on, and we'll go through these in a little bit. Number two, and a big one, right, is cognitive function. We know that over time, mental sharpness is going to decrease, and it decreases differently from everybody. Again, there's 85-year-olds that could run circles around me. I'll be the first to admit it. I've had some on my podcast. I cannot believe their level of sharpness, and whatever they're on, I want to be on that. But listen, as cognitive decline starts to set in, it may affect medical decision-making. It just will, and we need to talk about these things. So regular cognitive assessments can absolutely help us to self-monitor where we are over time, and potentially cognitive assessments coming from the outside will be helpful. And again, somewhat controversial in the medical field because people have dedicated so much time and effort, and then to be asked to take a cognitive test that maybe is just being forced is so hard to have that conversation, but it needs to happen. Number three, I got to be honest with you, and this is something that honestly we could do an entire show on. And in fact, we should have financial advisors on to talk about this. some physicians, despite having pain, cognitive issues, burnout, all kinds of stuff, do not feel that they can exit the workforce because they do not have adequate savings and they have not focused on their retirement plans. It's a big one. And it makes it a lot easier to consider, retirement if you are financially set than if you don't know what you're going to do if you leave the workforce. And this is a big, big problem. Number 4, burnout, professional satisfaction. Things have changed so dramatically over the last couple of decades. In fact, they've changed more over the last couple of decades than they did for a long period of time after that. And I mean the way things are: electronic medical records, growth of administrative systems, private practices being bought out by larger systems, and physicians losing their autonomy. It is it's difficult, and that might push people out. But to be honest with you, there's just as many physicians that are tremendously satisfied in their entire their entire way that they look at themselves and their egos, not in a bad way. I'm just saying their self-esteem is all based on them being a physician. This is truly who they are. They love what they're doing. They love to teach students. They love to take care of patients. It becomes such a difficult thing to step away when you love doing what you're doing so much. And so I've seen people just hanging on when clearly there are so many other issues going on, but they just plain love it and don't know what to do afterwards. And then, the last big one is, what is their work-life balance? Some people have really good work-life balances and they just want to stick around even if it's time. But it's a factor to consider when you have retirement. Some people just plain all want to retire because they want to spend more time with their children, their grandchildren, doing hobbies, writing that book they always wanted to do, traveling the world, or whatnot. So I think those are the really big 5 factors that come into play as we're thinking about how to transition into retirement. And it should be, it really should be a graduated, measured approach. Now, the next thing I just want to, get out there is, how do institutions approach policies related to physicians, being retired? Now, there are guidelines, for example, from the American College of Surgeons for competency, okay? And so the guidelines emphasize doing regular assessments, making sure that we are keeping up with continuing education, mentorship programs, either, which helps both ways because you pair senior and junior physicians, and this really can help on a cognitive scale. And also the American College of Surgeons does want us to promote flexible work arrangements because as we age, our needs change. And it's very, very important that these policies strike a critical balance between patient safety, but respecting, and I cannot emphasize the word respect enough, respecting the dignity and the autonomy of experienced physicians. And I have heard some things that really should never have been said. I've heard things, in the doctor's lounge by people questioning, physicians that are ultimately just tremendously competent. And it's heartbreaking and it's not fair. And there's ageism in there. We've got to be very, very careful in the way that we approach these things and be very respectful of physicians. And this goes for any practice. This goes for nurses and physician assistants and everybody else. But when it comes to physicians, our responsibilities are so incredibly difficult in life and death, situations. And ultimately, we are mostly, in most situations, the captain of the ship. And it's very important to make sure that we're competent, but respect for the older physicians. And this goes for our society. We need to respect our elderly for their wisdom, just like they do in so many different cultures. But unfortunately, that is not the overriding theme of our culture today, and we could talk about that, going forward. So the science being, what is some of the science behind it? We're not going to go into hardcore research studies and things like that because I don't want anyone to feel that I'm cherry picking this study or that study. But I'll tell you, let's speak more broadly. There are systematic reviews that are looking at certain procedures, and they tend to potentially have better outcomes in younger physicians than older physicians, but that is in no way uniform across. I think that is a very simplistic way of thinking about these procedures because honestly, if you think about it, if somebody's going to do surgery on me, I certainly want them, as long as they're competent and are really at a functioning at a very high level. I want the most experienced people operating on me. That's just my choice. I have patients that would rather see, physicians that are, are a lot older than me, and I have patients that want to see physicians that are 2 years out of practice because they have this conception that they have more of the newer information and can provide different care. Those things are way, way too broad of a stroke, to paint. We have to look at this on a much more individualized basis. There's other studies that also show that as far as making clinical decisions, adhering to treatment standards that then can affect patient outcomes. Some show that maybe more younger physicians can do it better, but it goes both ways. It really honestly does. And I think that's why I did not want to try to cherry pick studies on this particular kind of topic, because honestly, I can present it however I want, but I want to present a very balanced approach because truly, right, it may be better to have somebody in their 70s doing your surgery that really knows what they're doing and is performing well than a younger physician that looks vibrant and robust but is not as experienced at that procedure and really doesn't have the wisdom if something, goes wrong or we have to deviate from the original strategy. So these are really complex issues. And so I don't want to get too far into the weeds on this topic, but I can tell you that there are studies that also show that cognitive decline, sometimes in the 70s, there is not much cognitive decline, and there are studies that show that physicians in their 70s sometimes can perform as well as their peers that are younger. And so again, I don't want to go into studies because we could talk about this all day, but it's just about having a balanced approach, and it's not a one-size-fits-all. So let's talk about a little bit about the physical and cognitive decline that happens. There's no question that physically, you guys know this, right, that are listening to this program, as we get from decade to decade, there's obviously going to be some level of decline. You're not going to sprint as fast when you're 50 than you were 30. You're not going to run as fast when you're 70 that when you're 50. Now, again, on a one-off, maybe, but in general, that is just not the way it works. It just doesn't work that way. The same thing with cognitive decline. Some studies, show that cognitive decline can even start in the 30s. Again, it's not a one-size-fits-all, but we really have to figure out ways to be honest, open, have these conversations, but self-honesty is the most important, and relying on those around us to tell us, hey, maybe you should get checked. Hey, you're having a lot of pain. You're having a physical issue, or maybe your cognition doesn't seem as good. It's always good to be responsible for ourselves and being honest. So if our manual dexterity is worsening, if we're having trouble with hearing or visual acuity, we've got to seek care for this. It's very, very important, and it's important to seek this proactively. Now, when you start getting into more, in topics such as neurodegenerative disease, just like the rest of the population, where there's an increase in Alzheimer's disease and other neurodegenerative conditions. Same thing happens, obviously, with physicians and other providers and things like that. So obviously, when those things start to happen, it can absolutely impact our ability to safely practice medicine. And that's why I am somewhat of a proponent, at least for self-testing as far as cognition, being open and honest about when things are changing, even if it's going to impact doing what we love on a daily basis. But we have to address these changes proactively because you know what? Some cognitive decline can absolutely be reversed. It could be a metabolic, dysfunction. It could be too much stress. It could be other things. We don't want these things to fester. And so if we are regularly checked, we can know when it's time to seek the appropriate help and then try to reverse this so we can continue doing things we love. Appropriate initial interventions need to look at reducing workload, seeking opinions outside of our usual circle, outside of ourselves, and maybe just transitioning to less demanding roles, because sometimes that's all it takes, right? To start feeling better, and then all of a sudden your cognition, can, really improve. So on that note, we need to take a very, very balanced approach. So let's talk about what are really the challenges. Why did I start this episode talking about how challenging it is to discuss this and how it's almost controversial and it shouldn't be. Whether or not if an airline pilot is not cognitively or physically able to fly an airplane, that is not controversial. I don't want to get on an airliner where I'm at risk, and neither do you, all right? So the same standards really need to apply to physicians. On the flip side, right? Just because I see an older pilot, when I see older pilots, I think of, Captain Sully wasn't that old, but I think of experience that makes me comfortable. But I also am relying on the governing and regulatory bodies to make sure that those pilots, no matter what their age is, are fit for duty, can do it physically and mentally. So why is it even a controversy in medicine? Why does this have to be like backroom talk? Why does it sometimes have to end badly with physicians almost being pushed out, in a very upset way where nobody's happy, and it's just not the way that it should be. So there's no question. So what are some of the really controversial topics? I can tell you a contentious issue: mandatory retirement age for physicians. Very contentious. Are there places where this is, a fact? Yes, most places don't have that. And do we need to look at something like that? Here's the problem. Here's what I have. Here's my problem with age. It's not a number. It's not a number. I'd rather an amazing 80-year-old physician who has great dexterity and a world of knowledge do my surgery than somebody who's 35 and is not great at that surgery, and also is not, their line of thinking might not be the same. Again, I don't know. Maybe that 35-year-old's amazing. Maybe they're not. It's not a one-size-fits-all. So retirement age, just like, doing retirement age for Social Security, things like that, we're all different. We can all sustain for different periods of time. So again, the argument for mandatory retirement ages, are based on patient safety and then declines in physical and cognitive abilities. I think a better way to do this, rather than just a one-size-fits-all, is looking at cognitive abilities through testing, looking at dexterity abilities through testing, talking to colleagues, doing 360-degree evaluations, which we should all be evaluated. I should be evaluated all the time, right? My colleagues should be evaluating me. You're doing good. You're not doing good. We need to be critical of ourselves so that we don't function in a way that we're not doing the best for our patients. And so that part is not ageist. It's not ageist. It's okay to test people on their ability, because think about what they're doing. Right? We're not saying you can't write books because you're 85 years old. We're saying, hey, you can't do it because of this, this, and that. I think that that's okay. But again, it's become a controversial topic, and I'm curious to see, what the audience thinks about it. And please leave it down below in the comments if you're watching the podcast version of this. Please, 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 because I want to know what you really think. I'm really, really worried about this concept of age discrimination. We've got to be extremely careful not to make sweeping generalizations. And that's why I really worry about putting and retire. Let's say we just I'm going to throw out a number. You have to retire at 75. Okay, I'm just pulling that out of the air, thin air. So that means as anybody, once physicians start pushing that, there might be some automatic sweeping generalizations. Oh, this guy's 72. He's almost a has-been. He's out of here. So I think it's a lot better to do it on a cognitive and dexterity testing and a ability to make decision-making testing basis than an absolute age. Again, ageism, there's really no place for ageism in the society. It's a huge, huge problem. And I've posted all kinds of things about different topics, nothing to do with physicians. And I've had so many comments in people that are in their 50s, 60s, and 70s complaining about discrimination that they felt against them because of their age, where they're not considered for jobs, they're felt to be too old, and they feel like they're awesome. And so we really need to have objective testing. It's not about an age. Age really is just a number. It's how old are you physiologically? How old are you cognitively? It's those kinds of questions that we have to ask. So really, in concluding this section, before we go to final thoughts here, how do physicians really successfully transition to the next level? Those that are contemplating a career change, and things like that. Again, that's not where I am. I'm in the middle of my career, but I'm thinking about it already. Why? Because I want to make a graceful exit. I don't want to be pushed out. I want to leave when I am really feeling like it's the right time to do it, and I always want to contribute. And my plan personally is to contribute for the rest of my life, whether it's through media, writing the book that I'm currently writing, and I have other books planned after that and other things. But how do we successfully transition? Number one, we've got to start planning early. We've got to start thinking about the retirement plans way before we intend to step back. Number two, what are alternative roles? Even if we have a physical or cognitive disability that develops, what can we do to continue giving back? Is it teaching? Is it consultant? Is it an administrative role? Is it writing books and media and all these other things that are so near and dear to my heart? Number three, as we are in practice, we have to prioritize self-care, maintaining physical and mental health through exercise, nutrition, cognitive activities, functionally based exercise that really mimics standing in surgery all day, and these things, preventative health care, biohacking, which you guys know that I could not be more of a proponent of. Number four, really seeking financial advice. I'm telling you, every day in the doctor's lounge, I talk to docs about where they are, and some of them are well past retirement age and are in panic mode and don't know how they're going to retire for whatever reason. You've got to find certified financial planners that can help you to be prepared for retirement. That goes for all specialties and practices and professions. If you're financially unwell, you can't retire. And finally, stay connected. Maintain professional networks so you can understand kind of what's going on and what the opportunities even are. Mentor the young folks. Maintain relationships even as you start potentially decreasing your own work hours or time in the operating room or even time as an administrator, because even administration can become extremely onerous when you're having cognitive and physical and other declines. It's hard to sit there all day if you're in pain all day, and then you start asking, why am I even doing this? Why do I need to do this? And again, planning for retirement could not be more overstated, and it's something that I and many people in Gen X absolutely need to be thinking about, and they need to be thinking about it really hard, because we don't want to be sitting here 10, 15, 20, 25 years from now with no plan, not knowing what to do, and all of a sudden being pushed out because we're not ready, and we have experienced physical and cognitive decline. So, on that note, we'll end this section here. We'll see you on the other side of the break, and we'll conclude with some thoughts about physician retirement and when is the right time to pull the trigger. We'll see you on the other side of the break. back, everyone, to Recharging the Human Battery radio show. I'm your host, Dr. Stefano Sinicropi. We are on AM 950 radio, and it has been my absolute pleasure to be with you today talking about when is it the right time. You know, when to leave the workforce, when to leave becoming a physician, when to transition into non-physician life is absolutely as important as how to lead, how to be a great physician. And it's that transition between your working years and your retirement years. You want that transition to be smooth. We want it to be I don't want to say a happy time. If it can be a happy time, that's great. There's always, nostalgia for what was or, what has been. And obviously we love medicine. We don't want to leave. It's hard to do it. But doing it in an orderly fashion where it's not a being pushed out is incredible. And having a plan is so, so important. It's complex. It's a nuanced issue. Again, there's not a one-size-fits-all approach. This transition has to be navigated in a way that really fits our personal and professional values. And we want to leave feeling respected, feeling that we've put in our time, that we've given back, and we can continue to give back despite the fact that we're not in the operating room and not in the doctor's office. What we do need is a clear and comprehensive approach. We have to get rid of this fear of talking about these things. If there is clearly either within ourselves or within our colleagues, cognitive or physical decline that we see, we need to address it. Our governing bodies need to address it. Hospital systems need to address it. Yes, it is not a one-size-fits-all approach, but we absolutely need to thoughtfully and proactively have a plan of measuring cognitive ability, measuring decision-making ability, and measuring our ability to be dexterous and be able to physically handle the absolute rigors of being physicians and surgeons. So, in summary, I hope that I've at least outlined for everybody thinking thought patterns in the way we can approach this, have stimulated some of your own thoughts on this. I would love to hear about your experience with older physicians, whether they have been mentors to you or whether they have been your personal treating physician. And I'd love to hear some wonderful stories about healing and help that they have given, their wisdom. They've given everything for the profession. They need to be respected. And, I wish those that are planning to retire nothing but a wonderful retirement. Enjoy your time. You deserve it. My only ask is that if you can sneak it in there, please, 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 give us a window into your wisdom, your knowledge. Tell us your mistakes, what you wish you would have done differently. Tell us your pearls on how to get out of very difficult situations and very difficult times in patient care, navigating the system and others. And please tell us what you think about the future of medicine and what we need to do to address the horrible chronic health crisis that we're undergoing and all the radical changes that are happening literally at the speed of light today. Thanks for joining us, everybody. This has been one of my favorite episodes personally because I love this topic and I think that we need to be talking about it more. And we'll see you next time on another episode of Recharging the Human Battery on AM 950 Radio. Goodbye, everyone.